announced this afternoon that he was nominating Timothy Massad to run the Commodity Futures Trading Commission, which regulates the futures and options market. Going live now to the House of Representatives.
Meetings today on motion to suspend the rules on which a recorded vote or the yeas and nays are ordered, or on which the vote incurs objection under Clause 6 of Rule 20. Recorded votes on postponed questions will be taken later. For what purpose does the gentleman from Michigan seek recognition?
Mr. Speaker, I would move to suspend the rules and pass S-252 as amended.
The clerk reports the title of the bill.
Senate 252, an act to reduce preterm labor and delivery and the risk of pregnancy-related deaths and complications due to pregnancy, and to reduce infant mortality caused by prematurity.
Pursuant to the rule, the gentleman from Michigan, Mr. Upton, and the gentlewoman from California, Ms. Capps, will each control 20 minutes. The chair recognizes the gentleman from Michigan.
Mr. Speaker, I would ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous materials in the record on the bill.
Without objection.
And, Mr. Speaker, I would yield myself such time as I may consume.
The gentleman is recognized for such time as he may consume.
Mr. Speaker, S-252, known as the Preemie Reauthorization Act, is designed to strengthen health care for children, especially vulnerable children. Not only does this bill reauthorize the Preemie Act, but it also includes the authorization of the National Pediatric Research Network and the reauthorization of the CHIMP Act. The original Preemie Act that I sponsored and was signed into law back in 2006 in December brought much needed attention to the problems related to preterm birth. Since its enactment, we have made a lot of progress, but we can and we still must do better. According to the CDC, an estimated 500,000 babies are born premature every year in the United States. That's about 1 in 8. This legislation will continue and strengthen the ongoing effort to track, prevent, and treat prematurity, ensuring that every child has a healthy start and a better chance at a healthy and productive future. In addition to addressing premature births, this legislation also seeks to help children and their families with unmet health needs. The National Pediatric Research Network brings us a step closer to providing more help to children with rare pediatric and genetic diseases. This effort is going to help families like the Kennedys in my district in Mattawan, Michigan. Eric and Sarah Kennedy have 2 wonderful little daughters, Brooke and Brielle. Brielle is here in this picture, who have a rare spinal disease called spinal muscular atrophy. These 2 little angels, who are affectionately known, at least in my family, as Sleeping Beauty and Cinderella, are 2 little warriors in the effort to boost research for rare diseases and serve as an inspiration for every one of us. The sad reality is that it is often difficult to conduct research into the rare diseases due to the small number of kids with that disease. But today, with this bill, we're working to change that and provide families with greater hope for a cure or advances in treatment. This bill will help establish pediatric research networks and consortia that are effective in overcoming gaps in research. Networks and consortia that will be comprised of leading institutions that act as partners to consolidate and coordinate research efforts. And as this multi-year effort is finally nearing the finish line, yes it is, we say to the Kennedys and so many other families across the country with a similar circumstance, you are not alone in this fight. Lastly, this package includes reauthorization of the CHIMP Act of 2000 that helped establish the sanctuary system for chimpanzees that were retired from research. This bill reauthorizes the program at the current spending level for NIH's care of chimpanzees and reduces it through the next 5 years. It also is going to require the GAO to study how the NIH cares for the chimps and ask the GAO to identify how we can further save taxpayer money. I want to particularly commend Mrs. Eshoo, Mr. Lance, Ms. Capps, who has time here tonight, Ms. McMorris-Rogers, and in the Senate, certainly Chairman Harkin and Ranking Member Alexander for their wonderful efforts on this legislative package. Working together, yes, we are making a difference in the lives of so many. So I would urge my colleagues to join me in support of this legislation, and I reserve the balance of my time.
The gentleman from Michigan reserves. The gentlewoman from California is recognized.
Mr. Speaker, I yield myself such time as I may consume.
The gentlelady is recognized for much time as she may consume.
I rise in strong support of Senate Bill 252 as amended. As amended, this bipartisan legislation would address critical health care issues through the authorization or reauthorization of 3 different programs. Title I of the legislation reauthorizes the Prematurity Research Expansion and Education for Mothers Who Deliver Infants Early Act, better known as the PREME Act. The PREME Act was initially enacted in 2006 in response to an alarming a rise in the number of premature deaths. Premature deaths, those that occur prior to 37 weeks of pregnancy, are the leading cause of newborn deaths and long-term neurological disabilities in children. Since 2006, efforts across the Department of Health and Human Services have contributed to 6 straight years of decline in the preterm birth rate. There's no question we've made progress in addressing preterm births in this country. Yet, 1 in 8 babies is still born premature, and prevention remains a challenge due to the numerous, complex, and poorly understood causes of preterm birth. As a nurse, I know too well the physical cost of prematurity on both mother and child, the emotional costs it takes on parents, and the fiscal cost that prematurity plays in our healthcare system. Reauthorization of the PREME Act is necessary to continue the progress we have made to date and to do better by improving the health of mothers and babies. Now, Title II of Senate Bill 252, as amended, calls for the establishment of a National Pediatric Research Network at the National Institutes of Health. This title builds upon the strong body of pediatric research the agency currently supports and strengthens it to improve research and clinical trials on pediatric diseases, to train pediatric researchers, and to disseminate research findings quickly so that all children may benefit. By developing a nationwide network of pediatric researchers, renewed efforts can be focused to develop treatments and cures for pediatric diseases and conditions, especially those that are rare. Children have unique health care experiences, treatment needs, and research challenges. And while public and private research has come a long way on pediatric diseases over the years, we know that we are still far behind on important diagnostic cures and treatments for far too many ailing children, and that's why this title is so important. Many of my colleagues know that this legislation is particularly important for one family in my congressional district, the Strongs. Victoria and Bill Strong are focused every day on getting the best care and treatments for their young daughter, Gwendolyn, who has spinal muscular atrophy, the same condition that my colleague, Mr. Upton, just referred to in his district. Her diagnosis has fundamentally changed the daily lives of their family, her school, and our Santa Barbara community. The low prevalence of these diseases makes them particularly hard to research. But for those affected, like Gwendolyn and others, a new cure or treatment could mean a world of difference. This title is common sense for Gwendolyn and all the other kids out there facing a rare medical disorder and their families. As Title II of this legislation, the title National Pediatric Research Network Act is an important step forward to helping these families and those who may develop these diseases long into the future. And I noticed that over the weekend there was a marathon that Gwendolyn and her father participated in my community to raise money just for the same purpose as this research would do. So it's both from the public and the private side that there's a concerted effort toward this end. And this network is based upon H.R. 225, bipartisan legislation I authored with my colleague, Representative Kathy Morris Roger, passed in the House as a standalone bill on suspension earlier this year with strong bipartisan support, and I'm so pleased to see it included in this package today. Title III of the legislation ensures the National Institutes of Health can continue to care for chimpanzees that have been retired from research. In 2000, Congress passed the Chimpanzee Health Improvement, Maintenance, and Protection, or CHIMP Act. The CHIMP Act established a sanctuary system for the lifetime care of chimpanzees no longer used in research, limited NIH spending on care for these chimpanzees, and required matching funds from nonprofit entities contracted by NIH to operate the sanctuary system. Today, NIH owns or supports hundreds of chimpanzees. Following a report from the Institute of Medicine, NIH has concluded the vast majority of its chimpanzees should be permanently retired from research. And this title makes it possible for the NIH to continue caring for the more than 100 chimpanzees currently in sanctuary and transition other chimpanzees to sanctuary over time by authorizing appropriate amounts of spending for fiscal years 2014 through 2018 out of the totals made available to the agency. It's a common sense and humane measure to fulfill the mission of the institutes and responsibly tend to the chimps in our care. I want to commend Chairman Upton, Chairman Pitts, Ranking Member Waxman, and Ranking Member Pallone for their leadership in bringing this bipartisan package of public health legislation to the floor. The staff on both sides of the aisle who have worked so hard on this legislation, and the Senate Help Committee leadership, Senators Harkin and Alexander, for their efforts on these measures. Moreover, Energy and Commerce members Congressman Eshoo, Congressman Lance, Congresswoman DeGette, and Congresswoman McMorris-Rogers are also to be commended for their work on the PREMIE Act and the National Pediatric Research Network titles. These are critical bills, all of which deserve strong bipartisan support, and I urge my colleagues to join me in supporting S-252 as amended, and I reserve the balance of my time.
The gentlewoman from California reserves. The gentleman from Michigan is recognized.
Thank you, Mr. Speaker. At this point, I would yield 2 minutes to the gentleman from Pennsylvania, the chairman of the Health Subcommittee, Mr. Pitts.
The gentleman from Pennsylvania is recognized for 2 minutes.
Thank you, Mr. Chairman. I rise in support of another bipartisan bill, S-252, the Prematurity Research, Expansion, and Education for Mothers Who Deliver Infants Early Reauthorization, or the PREMIE Reauthorization Act, would take important steps to protect and improve children's health, particularly the health of the nearly 500,000 children born prematurely in the United States every year. Since its passage in 2006, the PREMIE Act has sponsored important research that has led to improved prevention and care of children born too early. This bill reauthorizes research and activities at the CDC related to the causes of preterm birth, improving data collection, and preventing preterm births. It also creates an advisory committee on infant mortality to coordinate federal, state, local, and private programs that address preterm birth and infant mortality. With 1 in every 8 infants born in the United States prematurely, this is a pressing issue. S-252 also authorizes the creation of the National Pediatric Research Network, a proven way to support pediatric research by coordinating multi-centered research activities, including those in rural areas. I would urge all of my colleagues to support this bipartisan bill, and I would like to commend Congressman Lance and Congresswoman Capps, Congresswoman McMorris-Rogers, Chairman Upton, and Ranking Members Waxman and Pallone for their leadership in this bipartisan effort. Thank you, and I yield back the balance of my time.
The gentleman from Pennsylvania yields back. The gentleman from Michigan reserves. The gentlewoman from California.
I continue to reserve.
The gentlewoman continues to reserve. The gentleman from Michigan.
Mr. Speaker, at this point I would yield 2 minutes to a leading advocate of this legislation, Ms. Kathy McMorris-Rogers, the chairman of the Republican Conference.
Thank you, Chairman. Thank you, Mr. Speaker.
The gentleman from Washington is recognized for 2 minutes.
I rise in strong support of the PREMIE Reauthorization Act. Every 3 minutes, somewhere in the world, a child is diagnosed with cancer. In the United States, approximately 150,000 children have diabetes. I believe that medical research is the best investment we can make to change these statistics and find new cures for these diseases. Working with my colleague from California, Representative Lois Capps, we introduced the National Pediatric Research Network Act, which is included in the PREMIE Reauthorization Act. In supporting this legislation, the Coalition for Pediatric Medical Research, which includes Children's Hospital in Seattle, from my home state, said that this legislation is critical to strengthen our nation's pediatric research enterprise. In addition, the Pediatric Research Network Act will authorize the establishment of a well-proven and evidence-based approach for addressing pediatric research. It will enable the National Institute of Health to support multi-institute research, to coordinate and streamline this important research. Most importantly, it will help to speed cures to the youngest patients. I urge support. Thank you, everyone, for your leadership, and I yield back.
Gentleman yields back. The gentleman from Michigan, reserved. Gentleman from California, continue to reserve.
I reserve.
Mr. Speaker, I would yield 2 minutes to another author of this legislation, someone who helped carry it across its bipartisan path, Mr. Lance from New Jersey.
Gentleman from New Jersey is recognized for 2 minutes.
Thank you, Mr. Speaker. I rise in strong support of S-252, the Preemie Reauthorization Act, which will provide vital and continued medical educational research in the national effort to reduce preterm births. This legislation will advance the great progress made since the 2006 Act and support federal research and community involvement in premature birth research. Our nation's premature birth rate is among the highest in the world, and it is the leading cause of newborn death in the United States. Infants born just a few weeks too soon can face serious health challenges and are at risk for lifelong health and learning disabilities. In addition to its human toll among infants and its toll on their families, premature birth costs our nation's economy much financially. And while the medical community has made great strides in identifying the risk factors associated with premature births, far too many premature births today have no known causes. It is fitting that the House will consider this legislation this evening. November marks Prematurity Awareness Month, a product of the fine work of the March of Dimes. And the March of Dimes estimates that since 2006, 176,000 fewer births have been babies have been born too soon because of improvements in the preterm birth rate. This is why the members of the House and the Senate have worked in a bipartisan and a bicameral fashion to reauthorize the 2006 Act. I thank Chairman Upton and Chairman Pitts and Ranking Member Waxman and Ranking Member Pallone for their leadership on this issue, as well as Senator Alexander and Senator Harkin and Senator Bennett. I especially thank my colleague, Congresswoman Anna Eshoo of California, for working on this important issue.
The gentleman is recognized for an additional 1 minute.
Thank you very much. I especially want to thank Congresswoman Anna Eshoo of California for working on this important issue that benefits the health and well-being of the American people. This is how Congress should work together on issues that make a lasting difference for the American people. It is in that bipartisan spirit that I ask all of my colleagues to join with us in support of the Preemie Reauthorization Act so that we as a nation will be able to continue our focus on premature birth research and prevention. My thanks also to Congresswoman Capps for her leadership as well on this issue. Thank you, Mr. Speaker, and thank you, Chairman Upton.
Gentleman from New Jersey. Gentleman from Michigan.
Mr. Speaker, I'm going to just close. I have no other speakers, so if the gentlelady... Oh, wait, I'm sorry. I have one more speaker.
Okay, gentleman from Michigan.
I'm sorry.
Then...
And do you have another speaker?
Gentleman from California, you continue to reserve? Or
I'll
do you
continue to reserve.
Continue to reserve. Gentleman from Michigan.
I'll yield 2 minutes to the gentleman from Texas, Vice Chair of the Health and Oversight Subcommittee, Dr. Burgess.
The gentleman from Texas is recognized for 2 minutes.
I thank the chairman for yielding. You know, the bill, the HOPE Act, is a common sense policy, and it's going to remove... Yeah, gentlemen.
Next.
I'll reserve.
You reserve back.
Gentleman from Michigan now reserves. Gentlewoman from California.
I'm just going to give the close and
all right, then I would do the same. And Mr. Speaker, I ask unanimous consent to submit letters of support from the following organizations into the record: the Children's Hospital Association, the Coalition for Pediatric Medical Research, Fight SMA, the Humane Society of the United States, the March of Dimes, and a joint letter from several health professional and public health organizations. So, Mr. Speaker, thank you. Mr. Speaker, I urge my colleagues to support this important package of public health legislation, and I yield back the balance of my time.
Gentlewoman yields back. The gentleman from Michigan.
Mr. Speaker, I would just say that every one of us has beautiful children like this in our districts. This bill is going to save lives. It has been bipartisan from the get-go, and again, I want to commend Republicans and Democrats in our committee, but certainly on the House floor when we passed this bill a number of months ago as well. And I just want to say, too, I was a speaker and a participant at an event just last week for Faster Cures, a networking group from around the country. Dr. Francis Collins was there, the head of the NIH. I spoke to Dr. Collins just in the last hour or so. He's delighted that this legislation is reaching the House floor tonight and hopefully will pass. And I know that we are going to continue to make a real difference in the lives of families, and that's what this is all about, and I would urge all my colleagues to vote yes. And I yield back the balance of my time.
The gentleman from Michigan yields back. The question is, will the House suspend the rules and pass Senate 252 as amended? Those in favor say aye. Those opposed, no. In the opinion of the chair, two-thirds being in the affirmative, the rules are suspended and the bill is passed. And without objection, the motion to reconsider is laid upon the table. Without objection, the title is amended. For what purpose does the gentleman from Michigan seek recognition?
Mr. Speaker, I would move now to suspend the rules and pass S-330, HIV Organ Policy Equity Act.
The clerk reports the title of the bill.
Senate 330, an act to amend the Public Health Service Act to establish safeguards and standards of quality for research and transplantation of organs infected with the human immunodeficiency virus, HIV.
Pursuant to the rule, the gentleman from Michigan, Mr. Upton, and the gentlewoman from California, Ms. Capps, will each control 20 minutes. The chair recognizes the gentleman from Michigan.
And I would ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous materials in the record on the bill.
Without objection. So ordered.
Mr. Speaker, I yield myself such time as I may consume.
The gentleman is recognized for such time as he may consume.
Mr. Speaker, I stand in strong support of S-330, known as the HOPE Act. The HOPE Act would eliminate the restriction on acquiring HIV-positive organs in order to permit research on transplants between HIV-positive individuals. The legislation will increase the number of available organs and help all those who are awaiting a transplant. In 1984, Congress enacted the National Organ Transplant Act, NOTA. The purpose of NOTA was to guide organ donation and transplantation. And in 1988, Congress amended NOTA to ban the transplantation of HIV-infected organs. Well, today, HIV treatments have extended and improved the lives of countless HIV patients. This, in turn, has increased the need for organ donations. This bill would allow research to fully evaluate the safety and effectiveness of organ transplantation between individuals and HIV. Specifically, the bill would permit research on transplants involving HIV-positive individuals by eliminating the restriction on acquiring HIV-positive organs. The legislation also would direct the Secretary of HHS to develop and implement standards for research on the transplantation of HIV-infested organs. And finally, the bill is going to require the Secretary of HHS to revise transplant standards based on that research. H.R. 698 is the House companion to the HOPE Act. Ms. Capps authored H.R. 698, and our committee, the Energy and Commerce Committee, passed it by a voice vote last July. Earlier this year, the Senate passed the legislation before us today, which was led by Senator Boxer, Coburn, Baldwin, and Paul, bipartisan group. By passing the HOPE Act now, we will send it directly to the President so that he can sign it into law and avoid a conference. This common-sense proposal has the potential to save lives. With 100,000 patients waiting for life-saving organs, permitting HIV-positive donors to be used for transplants could save as many as 1,000 HIV-infected patients every year. So tonight, We provide some hope for those in need of a new organ. I support this bill. I urge my colleagues to do the same, and I reserve the balance of my time.
The gentleman from Michigan reserves. The gentlewoman from California is recognized.
Mr. Speaker, I yield myself such time as I may consume.
The gentlelady is recognized for as much time as she may consume.
I rise in strong support of the HIV Organ Policy Equity Act, commonly known as the HOPE Act. The HOPE Act is a critical step towards improving the health and well-being of persons living with HIV and AIDS and strengthening our nation's organ transplant system. Many of us remember the fear and worry that surrounded AIDS in the 1980s. At first, no one even knew what caused AIDS, and the diagnosis was considered a swift death sentence. In that time of fear and the unknown, a blanket ban was placed on transplanting any HIV-positive organs, even for the purposes of research. However, in the last 25 years, medical research and technology has transformed HIV/AIDS care and treatment, and now, thanks to these breakthroughs, HIV is a more chronic condition. And this has led to improved life expectancies, something we can and should celebrate. But it also means that HIV-positive people are more likely to encounter medical complications as they age. They face unique complications as the powerful drugs that keep their HIV at bay often take a hard toll on their bodies, putting them at increased risk for ailments like kidney and liver disease. And for some of these problems, the only treatment is to wait on the same long waiting lists as all Americans do for an organ transplant. But there might be a better way. According to transplant experts, each year we toss out hundreds of HIV-positive organs that could be otherwise viable for transplantation into other HIV-positive people. These organs have the potential to save lives and lessen the transplant waiting list for all Americans, but instead they are wasted because of the archaic blanket ban that prohibits even the research to see if they could be used by those who already are HIV positive. And that's why we need to pass the HOPE Act today. The HOPE Act would create a pathway grounded in medical science to research the feasibility and safety of positive-to-positive organ transplantation. Think about it. This is a chance to possibly shorten the waiting list for everyone waiting for an organ, deliver better health outcomes for those in need, and lower health care costs by moving individuals off the dialysis rolls, all while maintaining the safety and integrity of our current organ transplantation system. That's what the HOPE Act can help and will help do. It is common sense, fiscally responsibility, and the right thing for all Americans awaiting transplants. I'd like to thank and acknowledge Senator Boxer and Senator Coburn for championing this issue in the Senate. With their leadership, the HOPE Act passed by unanimous consent in June. I also would like to thank my colleagues, especially Mr. Harris, the Republicans' lead on this bill, and also Dr. Burgess, a co-sponsor and strong supporter of this bill, for their leadership. And finally, I'd like to thank all the advocates who have worked so hard in support of this legislation. I'm pleased to stand with an incredibly broad coalition of health professionals and HIV/AIDS advocates in backing S-330. The HOPE Act is a common-sense bill that creates a path forward for research on this issue. It has strong support on both sides of the Capitol and on both sides of the aisle. It's a critically important issue. It's an opportunity to save lives. And that's why I'm urging a yes vote on S-330, the HOPE Act today. Reserve the balance of my time.
The gentleman from California reserves. Gentleman from Michigan.
Mr. Speaker, I would ask that the balance of my time be managed by Mr. Pitts. Ask unanimous consent.
Objection. It's ordered. Mr. Gentleman, Mr. Pennsylvania is recognized.
Thank you, Mr. Chairman. I yield myself such time as I may consume.
The gentleman from Pennsylvania is recognized for as much time as he may consume.
Mr. Speaker, I stand in support of another bipartisan bill this evening. The HIV Organ Policy Equity Act, or the HOPE Act, would lift a ban dating back to the 1990s on acquiring HIV-positive organs so that the Department of Health and Human Services can conduct research on the safety and effectiveness of transplants between HIV-positive individuals. As HIV treatments have advanced over the last 30 years, many HIV-positive individuals are living longer lives. but they are also more likely to experience conditions such as kidney and liver failure, which necessitate a transplant. This bill provides a potential path to a separate organ donation pool for HIV-positive organs, hopefully increasing the overall number of organs available for transplantation. The HOPE Act passed the Senate by unanimous consent in June and is supported by the American Society for Transplantation and the American Society of Transplant Surgeons, among others. I would encourage my colleagues to support this bipartisan common sense bill and would like to commend Drs. Harris, Dr. Burgess, Ms. Capps, Chairman Upton, and the ranking members Waxman and Pallone for their leadership on this bipartisan bill, and I yield back the balance of my time.
Gentleman reserved from Pennsylvania. Gentleman reserves. Gentleman from California.
Mr. Speaker, I'm pleased to yield whatever time she needs to consume to my colleague from the Washington, D.C. District, Eleanor Holmes Norton.
The gentlewoman from Washington, D.C. is recognized for as much time as she may consume.
I thank my good friend from California, and I thank all of the bipartisan leaders of this bill, especially Ms. Capps, who has made health care a signature issue for her ever since coming to the Congress. Mr. Speaker, we haven't found our way out of one of the great disparities in medical science. The difference between the 100,000 patients seeking organ transplants and the mere 30,000 who get such transplants annually. The HOPE Act provides a possible breakthrough, one that I don't think we can refuse. And it's a breakthrough for many of those who otherwise would really, whose condition would make them hopeless in waiting for an organ transplant. The regular reviews to evaluate medical research that are mandated by this bill could allow transplants from HIV-positive donors to HIV recipients. If the procedure, and this is important, the safeguards are tightly woven into this bill, if the procedure is shown to be both safe and effective, no wonder the Boxer-Coburn HOPE Act was passed by unanimous consent in the Senate. The wholesale ban in 1988 did not even allow research on HIV-infected organs. I'm not sure I understand that, since in this country we usually do not take research out of the picture. But today, medical science has come a long way, allowing many to live with HIV. We save many lives, but lose them anyway to chronic conditions such as kidney and liver damage, often caused by the very HIV medications that have saved their lives. If they go on dialysis, there is virtually no hope for a transplant today. The way out of this conundrum is the way we have understood since the Enlightenment. Look for the evidence. Who can know where the science will take us or whether it will take us anywhere? With estimates of as many as another 600 organ donors who could be helpful annually, who would not want to try to find if this could be accomplished? Again, I thank the sponsors of this bill, which I think is rightfully named the HOPE Act.
Gentlewoman yields back. The gentlewoman from California reserves. Gentleman from Pennsylvania.
Mr. Speaker, at this time I'd like to yield 2 minutes to the gentleman from Texas, the Vice Chairman of the Health Subcommittee, Dr. Burgess.
The gentleman from Texas is recognized for 2 minutes.
And I thank the Chairman for yielding. This bill before us tonight is a common sense policy that will remove some barriers in the law and ensure patients who are suffering from life-threatening illnesses can access vital treatments. We've heard the numbers discussed tonight. Over 100,000 patients currently awaiting life-saving organs. That number grows by thousands every year. coupled with the fact that our current organ donation policies are outdated and do not reflect the most current research and clinical developments. So the bill before us tonight corrects this, allowing organs from HIV-positive donors to be transplanted into HIV-positive recipients, and this has the potential to save over 1,000 HIV-infected patients every year with liver and kidney failure. Allowing the HIV-positive donations to increases the organs that are allowing these HIV-positive donations increases the organs available to HIV-positive recipients, and more importantly, it actually grows the overall pool of organs that will be available. Further, transplant surgeons already have experience with the transplantation of infected organs. Today, surgeons perform organ transplants on patients who are infected with hepatitis C, a disease with similar transmission methods as HIV. And I would reassure my colleagues, I have taken the time to speak with transplant surgeons from the American Society of Transplant Surgeons, spoken with doctors in the National Institute of Health. This does not pose an increased health risk for the already HIV-infected patient from the recipient of an organ donated by an HIV-positive donor, but it will provide the potential for increasing the number of organs available for transplant, and anybody who works in transplant surgery knows that this is the #1 issue that they face on a day-to-day basis. This legislation is sound, science-based policy. It's also good fiscal policy. It increases the options for safe transplantation, eliminating the need for patients to receive costly recurring treatments, and instead allows patients to receive viable organs to live fuller, more productive lives. I urge colleagues to vote in support of this life-saving bill. I yield back to the chairman.
The gentleman from Texas time has expired. The gentleman from Pennsylvania reserves. The gentlewoman from California.
I would ask the gentleman from Pennsylvania if he has more speakers.
Yes.
I'll continue to reserve.
The gentlewoman reserves. The gentleman from Pennsylvania.
Mr. Speaker, at this time I'd like to yield 2 minutes to the gentleman from Maryland, Dr. Harris, one of the leaders on this issue.
The gentleman from Maryland is recognized for 2 minutes.
Thank you very much, and I want to thank the chairman of the subcommittee for yielding time. Mr. Speaker, the HOPE Act is exactly the kind of bipartisan legislation that will improve lives and have a positive impact on our health care system. You know, as a physician for nearly 30 years who's participated and conducted medical research, I know firsthand how medical innovation often outpaces government laws and regulations. This is one such example. As an anesthesiologist, I've had the privilege of taking care of many patients for transplant surgery, and I've seen numerous times the life-saving joy that an organ transplant brings to patients and their families. The HOPE Act changes an outdated law by making government work in a more efficient and effective manner for all patients needing transplants, both those with HIV and those without, which is exactly what the American people expect from us here in Washington and from their elected officials. Mr. Speaker, it's time to move the HIV Organ Policy Equity Act, Senate 330. I want to commend the gentlelady from California for working with me to get this bill through. People are waiting for these organs, and I urge my colleagues to vote yes on Senate 330 later tonight. I yield back the time.
The gentleman from Maryland yields back. The gentleman from Pennsylvania reserves. The gentlewoman from California.
Are you prepared to close? Okay.
Gentlewoman from California.
Thank you, Mr. Speaker. Mr. Speaker, I ask unanimous consent to submit letters of support from the United Network for Organ Sharing and a coalition of health professional and HIV/AIDS advocacy organizations.
Without objection.
And I also urge my colleagues to support this important common sense legislation, and I yield back the balance of my time.
The gentlewoman yields back. The gentleman from Pennsylvania.
Mr. Speaker, I also would like to ask unanimous consent to include an exchange of letters between the Committee on Energy and Commerce and the Committee on the Judiciary on H.R. 698, the House companion bill to S. 330.
Without objection.
With that, Mr. Speaker, I also urge support for this bipartisan common sense legislation. I yield back the balance of my time.
The gentleman from Pennsylvania yields back. The question is, will the House suspend the rules and pass Senate 330? Those in favor say aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative, the rules are suspended. The bill is passed, and without objection, the motion to reconsider is laid upon the table. For what purpose does the gentleman from Florida seek recognition?
Mr. Speaker, I move to suspend the rules and agree to Senate 893.
The clerk report the title of the bill.
Senate 893, an act to provide for an increase effective December 1, 2013, in the rates of compensation for veterans with service-connected disabilities and the rates of dependency and indemnity compensation for the survivors of certain disabled veterans and for other purposes.
Pursuant to the rule, the gentleman from Florida, Mr. Miller, and the gentleman from Maine, Mr. Michoud, will each control 20 minutes. The chair recognizes the gentleman from Florida.
Mr. Speaker, I yield myself such time as I might consume.
The gentleman is recognized for as much time as he may consume.
And Mr. Speaker, I ask unanimous consent that all members would have 5 legislative days with which to revise and extend their remarks and include any extraneous material they may have on Senate 893.
Without objection.
Mr. Speaker, as chairman of the House Committee on Veterans Affairs, I rise today in support of Senate 893, the Veterans Compensation Cost of Living Adjustment Act of 2013. Mr. Speaker, it's entirely appropriate that we consider this legislation today after we honored America's veterans yesterday. This critically important legislation that authorized a cost of living increase for disabled veterans in receipt of disability compensation payments from VA, veterans clothing allowance payments, and other compensation for survivors of veterans who die as a result of their service to this country. The amount of the increase is determined by the Consumer Price Index, which also controls the cost of living adjustment for Social Security beneficiaries. That increase is scheduled to be 1.5%. I want to thank Congressman Runyon of New Jersey, the chairman of the Subcommittee on Disability Assistance and Memorial Affairs, for introducing H.R. 569 that was the companion bill to this piece of legislation. I urge all of my colleagues to support Senate 893, and I reserve the balance of my time.
The gentleman from Florida reserves. The gentleman from Maine.
Thank you, Mr. Speaker. I yield myself such time as I may consume.
The gentleman is recognized for as much time as he may consume.
Thank you, Mr. Speaker. Yesterday was Veterans Day. Its origin began 95 years ago on the 11th hour of the 11th day of the 11th month. The armistice was signed, marking the end of World War I. The next year, we saw the first commemoration of the Armistice Day, which became Veterans Day in 1954. Every Veterans Day since then has been a day of remembrance and commemorating for all of our veterans. Today, we have the opportunity to put the thoughts and feelings of Veterans Day into practical action. Today, with the agreement of the House, we will ensure that veterans continue to receive the support they need. On October 28th, the Senate passed S.H. 893, the Veterans Compensation Cost of Living Adjustment Act of 2013, which provides that veterans receive a projected 1.5% cost of living adjustment beginning in January. This bill directs the VA to increase the rate of basic compensation for disabled veterans and the rate of dependency and indemnity compensation for their survivors and dependents. Since 1976, Congress has acted annually to increase these benefits by an amount estimated to keep pace with inflation. This year's increase is the same as that provided to Social Security recipients. Without this annual COLA increase, veterans, their families, and survivors would see the value of their hard-earned benefits slowly erode. Many of the millions of veterans and survivors who receive monthly benefits depend upon these payments in order to make ends meet. For some, it is their only source of income. Providing for the cost of living increase is an important thing that we all can do to help veterans and ensure that the value of their benefits does not decrease over time due to inflation. It is a way that we can, the day after Veterans Day, thank our veterans again for their service and their sacrifice. I urge my colleagues to support S. 893 and reserve the balance of my time.
The gentleman from Maine reserves. The gentleman from Florida.
Thank you, Mr. Speaker. I yield such time as he may consume to the chairman of the Subcommittee for Disability Assistance and Memorial Affairs, the gentleman from New Jersey, Mr. Runyon.
The gentleman from New Jersey is recognized for as much time as he may consume.
Thank you, Mr. Speaker, and Chairman Miller, thank you for yielding me the time. I rise today in strong support of S-893, the Veterans Cost of Living Adjustment Act of 2013. This bill is a companion bill to H.R. 569, which I introduced earlier this year in the House of Representatives. H.R. 569, which included in H.R. 357, which passed the House Veterans Affairs Committee earlier this year. S-893 provides a cost of living adjustment to veterans' disability compensation, survivors' dependency, and indemnity compensation and other benefits. Mr. Speaker, many disabled veterans depend on these benefits to make ends meet, and this bill will assist these veterans as the cost of living continues to increase. While I'm very supportive of this bill, I would like to once again state that it is unfortunate that we have to be here to pass this bill each and every year. That is why I introduced H.R. 570, the American Heroes COLA Act, which would authorize a COLA every year without congressional action. This would ensure that the COLA for the most deserving Americans is not tied to action or inaction in Washington. The House passed H.R. 570 earlier this year, and I remain hopeful that our colleagues in the Senate will follow suit so we can provide this needed benefit to veterans and their families without having to wait on Congress to act. Once again, I thank Chairman Miller and the House leadership for bringing this important legislation to the floor. I urge all my colleagues to fully support S-893. Thank you, and I yield back the balance of my time.
The gentleman from New Jersey yields back. The gentleman from Florida reserves. The gentleman from Maine.
Thank you, Speaker. At this time, I yield the gentlewoman from Nevada, Ms. Titus, as much time as she may consume.
The gentlewoman from Nevada is recognized for as much time as she may consume.
Thank you, Mr. Speaker. Chairman Miller, Ranking Member Michaud, thank you for yielding me the time. As the ranking member of the Disability Assistance and Memorial Affairs Subcommittee, I rise today in strong support of S-893 to provide a COLA increase for disabled veterans. In the wake of Veterans Day, let us take a lesson from President Kennedy's admonition that we should show our respect for our heroes not just through words but through actions. This legislation is an opportunity for us to take such action. With its passage, Congress can show tangible support for our nation's heroes. Unlike with Social Security recipients, Congress is required to adjust veterans' COLAs every year. S-893 would make that important adjustment for next year. That's a good thing, which I support, but I would also urge the Senate in the meantime to pass H.R. 570, the American Heroes COLA Act, that would allow for an automatic COLA increase so that veterans' benefits are not subject to any congressional delay. Making the adjustment automatic would remove this important benefit from the capriciousness of partisan politics or personal grandstanding. This bill was introduced in a bipartisan fashion by our subcommittee chairman, John Runyon, and me. It was unanimously approved by the House in May and is awaiting action down the hall. So while we await the passage of that automatic increase, passing S-893 is an important step forward. I support it. It will ensure that our nation's heroes receive all the benefits they have earned, and I would encourage my colleagues to support it as well, because this will be a true recognition of the veterans whose service and sacrifice we honored yesterday. I yield back.
The gentlelady yields back. The gentleman from Maine reserves. The gentleman from Florida.
Thank you, Mr. Speaker. I yield such time as he may consume to the chairman of the Subcommittee on Health, the gentleman from Michigan, Mr. Benishek.
The gentleman from Michigan is recognized for as much time as he may consume.
Thank you, Mr. Chairman. Mr. Speaker, I rise today in support of Senate Bill 893, legislation to provide a 2014 cost of living adjustment to disabled veterans and their survivors. With prices going up for groceries, gas, and utilities, an increase is needed for our veterans and their families in northern Michigan. However, without this legislation, there would be no COLA. As a doctor who served at the VA hospital Iron Mountain for 20 years and the father of a Navy veteran, I'm disappointed that our veterans are once again put at risk of being held hostage to Washington politics. Those who serve our nation should never have to wonder whether or not Congress will provide them with the benefits they have earned. In May, the House passed the American Heroes COLA Act, introduced by my friend and colleague on the Veteran Affairs Committee, Mr. Runyon. This legislation will permanently tie the COLA to the Consumer Price Index, the same as Social Security disability. I urge the Senate to immediately act on the American Heroes COLA Act, join the House of Representatives in a clear statement that our veterans must not be used as pawns in Washington political games. I again support Senate Bill 893 and yield back the remainder of my time.
The gentleman from Michigan yields back. The gentleman from Florida reserve. The gentleman from Maine.
Thank you, Mr. Speaker. I have no further speakers, so I urge my colleague to support S. 893 and send this important bill to the President today, and I yield back the balance of my time.
The gentleman from Maine yields back. The gentleman from Florida.
Thank you, Mr. Speaker. I, too, ask all my colleagues to support Senate 893 and yield back the balance of my time.
The gentleman from Florida yields back. The question is, will the House suspend the rules and pass Senate 893? Those in favor say aye. Those opposed, no. In the opinion of the chair, two-thirds being in the affirmative, the rules are suspended and the bill is passed, and without objection, the motion to reconsider is laid upon the table. Yeah, he's here. Is he going to be blocked? For what purpose does the gentleman from North Carolina seek recognition?
Mr. Speaker, I move that the House suspend the rules and pass H.R. 2871 to amend Title 28 United States Code to modify the composition of the Southern Judicial District of Mississippi to improve judicial efficiency and for other purposes.
The clerk reports the title of the bill.
Union Calendar Number 185, H.R. 2871, a bill to amend Title 28 United States Code to modify the composition of the Southern Judicial District of Mississippi to improve judicial efficiency and for other purposes.
Pursuant to the rule, the gentleman from North Carolina, Mr. Holding, and the gentleman from North Carolina, Mr. Watt, each will control 20 minutes. The chair recognizes the gentleman from North Carolina, Mr. Holding.
Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days within which to revise and extend the remarks and include extraneous materials on H.R. 2871 under consideration currently.
Without objection.
I yield myself such time as I may consume.
The gentleman from North Carolina, Mr. Holding, is recognized for as much time as he may consume.
H.R. 2871 is a simple and straightforward bill that responds to a single question. How should the federal judicial districts in Mississippi be organized to best serve the needs of litigants, jurors, the bar, and the public once the Meridian, Mississippi courthouse is permanently closed? The answer was developed by an ad hoc committee of judges that was formed late last year. And to their credit, they fashioned a solution that has been reviewed and endorsed by everyone from the affected local bar associations and the Inns of Court to the Judicial Conference of the United States. Specifically, the committee recommends 1, abolishing the Southern District's current Eastern Division, 2, modifying the statutory designations of places to hold court, and 3, realigning the remaining 4 divisions and places of holding court, and lastly 4, renaming the realigned divisions. The judiciary and offices within the Department of Justice have reported that they will achieve significant cost savings when this proposal is fully implemented. Quite simply, Mr. Speaker, the sooner we enact this bill, the sooner these savings can be realized. But beyond the goal of containing unnecessary costs, this legislation is a priority since the affected courts are engaged in time-consuming and expensive process of replenishing their jury wheel. That process requires the courts to identify names of possible jurors for criminal trials and grand jury service for the next 4 years and provide proportional representation under the new divisions. And that process is on hold until Congress passes and the President signs this bill. Acting through the administrative office of the courts, the judiciary proposed the gentleman from North Carolina, the chairman of the court's intellectual property and internet subcommittee, Representative Howard Coble. Chairman Coble immediately recognized the importance of moving this legislation expeditiously and personally committed his efforts to ensure passage.
And on behalf of the full committee chairman, Mr. Goodlatte, I also want to recognize the efforts of Ranking Member Mr. Watt and the other co-sponsors of this bill, which include Representatives Harper, Thompson, and Palazzo from Mississippi for their bipartisan support and advocacy. The Committee on the Judiciary reported this bill unanimously in September, Mr. Speaker. It is supported not only by those that I mentioned, but also by Senators Cochran and Wicker from Mississippi, who are committed to doing everything possible to advance the bill through the other body without delay. In summary, this is a good bill, and it is urgently needed to ensure the federal courts in Mississippi are authorized and organized to function in a manner most efficient and economical and least disruptive manner as possible. So I urge my colleagues to support this passage, and I reserve the balance of my time.
The gentleman from North Carolina, Mr. Holding, reserves. The gentleman from North Carolina, Mr. Watt, is now recognized.
Mr. Speaker, I yield myself such time as I may consume.
The gentleman is recognized for as much time as he may consume.
Mr. Speaker, I rise in support of H.R. 2871, which I'm pleased to be a co-sponsor of. This straightforward bipartisan measure will realign the Southern District of Mississippi. The bill has widespread support that includes my friend Representative Benny Thompson, who represents part of Mississippi, as well as the affected judges and local bar. Rarely is a bill introduced that is forthright, uncomplicated, has universal bipartisan support, and is expected to save money. H.R. 2871 has all of these characteristics. The bill simply reorganizes the existing district into 4 divisions, which will be designated as Northern, Southern, Eastern, and Western divisions. This simple reorganization is estimated to save approximately $135,000 due to reduced expenditures for juries and the services of the U.S. Marshals. I urge my colleagues to support this common sense measure and reserve the balance of my time.
The gentleman from North Carolina, Mr. Watt, reserves. The gentleman from North Carolina, Mr. Holding, is recognized.
Mr. Speaker, it is with pleasure that I yield to the leader of the North Carolina delegation and the chairman of the Subcommittee on Courts, Mr. Coble, such time as he may consume.
The gentleman from North Carolina, Mr. Coble, is recognized for as much time as he may consume.
I thank the Speaker, and I thank the gentleman from North Carolina for having yielded. It's pretty well, both gentlemen from North Carolina have pretty well covered this issue, but I will try to not be repetitive. I rise in support, Mr. Speaker, of H.R. 2871. The legislation will realign the Southern Judicial District in Mississippi. It has been reviewed and is fully supported by members of the majority and the minority from Mississippi. H.R. 2871 was introduced in response to a plan originally developed by a committee of federal judges from Mississippi, which was charged with formulating a plan to close the Meridian Courthouse. This courthouse is the only court facility located in the Eastern Division of Mississippi's Southern Judicial District. The primary goal of the Judges Committee was to recommend a realignment that best serves the needs of litigants, jurors, the bar, and the public. Given the review and endorsement of the Judicial Conference, the Fifth Circuit Judicial Council, the judges, U.S. Attorney and Federal Public Defender, local bar association, and ends of court alike, it appears the judges performed their duty in an exemplary fashion. In brief, H.R. 2871, Mr. Speaker, aligns and redesignates the judicial districts and places of holding court in Mississippi to improve the judicial efficiency. The CBO estimates that H.R. 2871 will create no budgetary impact. Its enactment will enable the affected judges, bar, and the public to be better served by a more rational structure, organization, and composition of federal judicial districts in Mississippi, and permit the federal judiciary and the Department of Justice to achieve substantial cost savings. H.R. 2871 is a good bill, as has been pointed out, and I encourage my colleagues to support that proposal. With that, Mr. Chairman, I yield the balance. I yield back the balance of my time.
The gentleman from North Carolina, Mr. Coble, yields back. The gentleman from North Carolina, Mr. Holding, reserves. The gentleman from North Carolina, Mr. Watt.
Mr. Speaker, I have no further speakers. I urge my colleagues to support this bipartisan common sense bill, and I yield back the balance of our time.
The gentleman from North Carolina, Mr. Watt, yields back. The gentleman from North Carolina, Mr. Holding.
Mr. Speaker, I want to thank very much Chairman Coble for his words. I also want to thank him for his friendship and his mentorship and the leadership that he has shown in this body, on the Judiciary Committee, and particularly on the subcommittee for intellectual property in the courts. I urge my colleagues to join with us in support of this bipartisan, common sense legislation to efficiently reorganize the courts in Mississippi, and I urge a yes vote on this, and I yield back.
The gentleman from North Carolina, Mr. Holding, yields back. The question is, will the House suspend the rules and pass Bill H.R. 2871? Those in favor say aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative, for what purposes, the gentleman from North